These people's lives are at risk. This is real. And Minister, I want to state a few things here, because this shouldn't be, and we're hearing the conversation here at this table, that it shouldn't be about recovery versus harm reduction. And, you know, there are mountains of evidence on the effectiveness of harm reduction programs like supervised consumption services and now safer supply. Will the Liberal government create policies based on evidence, or will they do it on reaction to the fear-mongering that's coming from this side? Let's look at the evidence of what happens when fear-mongering shuts down harm reduction programs. And I'm going to go back to the Conservatives, because it shouldn't be recovery versus harm reduction. We need both. In Alberta, banning of safer supply, closure of supervised consumption services, and adoption of a recovery model that lacks evidence and regulation has led to an 18% increase in drug toxicity deaths this year over 2022. In Saskatchewan, where harm reduction has been abandoned in favor of a recovery model, deaths in 2023 increased by 32% over 2022. Saskatchewan also has the highest rate of HIV in Canada, 19 per 100,000. In Ontario and BC, where there are relatively robust harm reduction programs, deaths are also increasing due to the unregulated fentanyl supply, but at significantly lower rates. BC deaths are up 5%, Ontario 6.8%, again compared to 18% in Alberta and 32% in Saskatchewan. Any increase in deaths is not acceptable to anyone at this table. It's a policy failure and morally reprehensible. But the Conservative anti-harm reduction and anti-safe supply disinformation campaign is most active in the provinces with the highest death rates. Minister, the data is clear, yet your government is stalling on providing SUAP funding for safer supply programs. Are your government policies on this issue based on evidence or opinion polling that is influenced by the false narrative of the Conservatives?
Chair, how much time do I have to answer?
A minute and 15 seconds.
Okay, so I agree with my colleague wholeheartedly. In addressing the overdose crisis, there is no either or. It's not a harm reduction or treatment. It's not safe supply or recovery. As I've said, and I will repeat again, we need a full continuum of care and healthcare interventions and services to help those who are most vulnerable and struggling with substance use. With regards to your question, Mr. Johns, we've contacted all of our programs on safer supply that are expiring, and it is my full intention to have our department review and renew those programs with proper mitigation measures in place with regards to concerns that have been raised on diversion. We do know there is evidence. We are collecting data. We are collecting evidence through CRISM, through these. That is exactly why SUAP exists, so that we have evidence to show if these measures are working. We know that those who are on safer supply programs begin a process of stabilization. They begin to make better health choices for themselves. It reduces criminal activity. It reduces someone going on the street to look for other alternatives to pay for illicit drugs that can cause them harm. We have to meet people where they are at in the moment when they reach out for help. That is why safer supply is such an important piece of the puzzle. And when we go to save lives, we cannot do an either or. We cannot stigmatize people when they actually step up and ask for help, to turn them away and say, no, it's either this or nothing.
Okay,
they will die of overdose if we do not meet them where they are at. And I say this as the Minister of Mental Health and Addictions, that it is my sole focus to save lives.
Thank you, Minister.